Nearly 28 million Americans suffer from migraine headache each year. But what exactly is a migraine headache?
Migraines are disabling, painful, recurring headaches that are often, but not always, one-sided. Migraines have had a dramatic impact on both American history and culture. During the Civil War, both Robert E. Lee and Ulysses S. Grant suffered from prolonged and repeated migraine headaches. As well, Thomas Jefferson endured migraines while helping to author the Declaration of Independence and the Constitution. Elvis Presley, the king of rock and roll, was also a migraine sufferer. In fact, contemporary doctors have suggested that much of the king's well-publicized drug use was actually an attempt to self-medicate his headaches, as opposed to a hedonistic pursuit. Determining if you have a migraine headache can be tricky. Patients experience a wide variety of symptoms associated with their migraine headaches, which means there is no such thing as a typical migraine. However, when suffering from migraine attack, people usually are sick to their stomach and often vomit. There are a number of other symptoms that are commonly experienced by migraine sufferers. Migraine headaches typically begin as a dull ache and progress into a throbbing pain. Typically, migraine lasts 4 to 12 hours, although particularly bad migraines can last as long as a week. When a patient is suffering from migraine headache, they are often very sensitive to light, sounds, and certain odors. Also, many migraine sufferers have difficulty thinking and feel off balance. If one or more of these symptoms is present, especially inability to function or nausea, it is very likely that the headache is migraine. These symptoms are quite different from the symptoms of other common types of headache. About 20% of migraine patients often experience an aura before and during their headache. An aura is the physiological warning sign that a migraine headache is about to begin. When patients experience visual auras, they often see bright spots or jagged lines. Some patients have sensory auras, pins and needle feelings that start in the hand and move up the arm. Rarely patients have scent-related auras, where they smell something that actually isn't there. Auras are the classic symptoms of migraine. If you're experiencing an aura prior to the onset of your headache, it is very likely that you're suffering from migraine. Today, there are a number of treatments that can provide effective, lasting relief for migraine headache sufferers. To learn about medications which can prevent you from getting migraine, as well as medications capable of controlling the attack after it begins, be sure to check out other short videos available in this series. Remember, migraine can be difficult to self-diagnose, so that if you believe that you have migraine, your first step is to see a physician with an interest in headache.
The movies in this series can be viewed in any order. If you wish to watch these clips in their original sequence, then the next clip is Migraine Auras Through the Looking Glass.